We're being warned the worst of the coronavirus is upon us, and that cases and casualties will rise this week to alarming rates. Good evening. It's Monday, April 6th. Thanks for joining us tonight. I am Maya Trabulsi, and we are broadcasting remotely tonight, hoping for the best but fearing the worst. We are being warned that the worst of the coronavirus is upon us and that cases and casualties will rise this week to alarming rates. Today, San Diego County officials reported an increase of 78 cases, raising the total number to 1,404. The silver lining, no new deaths, and some good news from the governor's office. KPBS reporter Shalina Chatlani has the latest.
We want to take this moment to ask every San Diegan to reach out to a senior citizen in their life who they know and check on them.
As San Diegans brace themselves for what state and national officials are considering to be an incredibly deadly month in the coronavirus outbreak, Supervisor Nathan Fletcher today reminded residents to consider the most vulnerable.
The burden that we bear on our seniors is obviously much greater. They've been asked to go into a different level of quarantine. They were asked to do it earlier. There also is more danger to our senior citizens.
The death toll in San Diego has not budged in the last day, but officials say the numbers may not reflect the severity of the situation. Here's County Medical Director Eric McDonald.
It is a lagging indicator, and the fact that that number hasn't gone up in a couple of days should not indicate anything in particular.
But even with this grim information, there was good news out of the state. More hospital beds, healthcare personnel, and an opportunity for the state to lend a helping hand to the rest of the country.
We're also extending a hand of support with ventilators. Today we announced 500 ventilators from our cash will be sent to the national stockpile to be immediately distributed to states in need.
Now, the reason we are able to lend a helping hand is because we have over 11,000 ventilators in the state. That's up around 3,500 from just a few weeks ago. But Governor Gavin Newsom did make it clear we do still have a lot of work to do to be prepared to meet peak healthcare demand in the coming month.
We're not naive that we need to continue to procure more ventilators, not just gowns, masks, coveralls, shields. We currently have locked in 4,613 specific bed sites now throughout the state of California. We have sites like this arena in every major region in the state of California.
That's about a quarter of the 20,000 beds the state is working to provide outside the state's hospital system. Hospitals have been asked to create another 30,000 beds in their own facilities. Here in San Diego, officials say some personal protective items, like face shields and gowns, are still critically low. Shalina Chatlani, KPBS News.
San Diego Mayor Kevin Faulconer is calling on all medical residents, nursing students, and former medical professionals to help with the expected surge in patients. He's urging them to register with the state's newly established California Health Corps. Tens of thousands across California are already signing up. Our country is bracing for a difficult week in the coronavirus fight, one that the U.S. Surgeon General compared to events like Pearl Harbor or 9/11. Today, the nation surpassed 10,000 deaths from the virus. States reaching their peaks are trying to help keep up demand for crucial medical supplies. Karen Kaifa has the latest from Washington.
Weeks into the U.S. battle against the coronavirus, healthcare providers in the nation's hotspots are bracing for what may be the most difficult stretch of all.
We are very, very worried about, in particular, our intensive care capacity.
The Trump administration forecasts a peak in U.S. cases in the next 2 weeks as states try to keep up. Michigan Governor Gretchen Whitmer said key facilities in her state have just days' worth of personal protective equipment, or PPE, for healthcare workers.
We are doing everything that we can at the state level to secure more personal protection equipment.
In New York City, ventilators are still a key concern for the coming days.
We're watching the numbers very closely to see if we're going to need more or how much more we're going to need after that.
Governor Andrew Cuomo said Monday New York State's daily death toll was up again, but relatively flat over 2 days, perhaps a hopeful sign.
The possible flattening of the curve is better than the increases that we have seen.
Modeling suggests Louisiana could be reaching a peak in cases, but other states saw weekend upticks like California.
It really is a race against time to have the equipment and the supplies that we need as the number of people in our hospitals continues to grow.
New Jersey and Pennsylvania also saw cases rise in recent days. In Washington, Karen Kafa, KPBS News.
And today, San Diego Unified School District students are attending classes from home. KPBS education reporter Joe Hong explains what distance look like for California's second largest school district.
The district today started what it's calling its soft launch for distance learning. Some teachers will start online instruction without grading assignments, while the district determines which students need internet and laptops before all schools move to formal grading 3 weeks from now. This morning, I talked to Rose Scalo, a senior at San Diego High School, who told me what her week would look like.
In math class, I've got a Zoom meeting tomorrow. We'll probably talk about what we're going to be doing in the future in that class, because math is a very hands-on subject. Whereas I'm taking government and politics, that's our teacher's just given us the assignments that he would have given us, because those are all just out of our textbook, which we have at home.
The district has released some details for its bigger picture plan for distance learning. The district will start formal grading on April 27th. In the meantime, teachers are expected to connect with their students and make sure they're ready for online learning. The district is also distributing Chromebooks over the next 3 weeks. Students who need them can pick them up at several high schools throughout the district. And during distance learning, students' grades will not go down from what they were before schools closed. This is in accordance with state guidelines. It's still early, but teachers for the most part feel they've been given the flexibility to adapt to student needs in this new learning environment.
Everything doesn't have to be live, that teachers are able to record their lessons and just provide those to students to watch when it's a convenient time. Because we know that some of our older students are now caring for their younger siblings, and people are sharing computers or trying to share the Wi-Fi in their homes, and so everyone can't be on their computers at the same time.
However, teachers still have concerns and unanswered questions, especially when it comes to special education.
We really have not received much guidance at all from the state or federal departments of education. So that's something we're waiting on, and once we get some guidelines, we can really move forward.
The teachers union and the school district have agreed to provide special education services to the fullest extent possible. Time will tell what that actually means. Joe Hong, KPBS News.
And you can go to kpbs.org to see the full list of schools where students can pick up Chromebooks and internet hotspots. And now that schools across the county are moving to virtual classrooms, students will be online more than ever. But the FBI says this makes them more vulnerable to unseen threats. The agency wants parents to be more vigilant now than ever as the potential for child exploitation grows with the increase in screen time. The FBI says online sexual exploitation comes in many forms and could begin with casual contact that increases to sexual conversations or images. The agency wants parents to be on the lookout for signs of behavioral changes in children. These could include nightmares, anger, depression, or anxiety.
Sometimes predators will try and build a friendship relationship with the child, what we commonly refer to as grooming. So they'll be friendly, they'll be complimentary, they'll try to be that friend that the child has never had. Other times, the predator will take a more aggressive approach and will be more demanding from the beginning in an effort to try and get those images quickly so that they can then extort the child into sending them more images.
And besides talking with your kids about appropriate internet activity, the FBI also advises parents take the following steps. Review all content and apps before they are downloaded. Make sure privacy settings are set to the strictest level possible. Keep computers in a common room. Check social media profiles and explain that posted images could be online permanently. The city of San Diego is entering talks with employee unions today to try to resolve a dispute over furloughs. KPBS Metro reporter Andrew Bowen says the coronavirus is already forcing some tough choices.
For weeks now, city libraries have been closed because of the coronavirus. Library workers have still been getting paid either by helping out in other operations or through paid leave. But last week, the city told hundreds of workers across several departments no more. If you don't have an alternate assignment and you can't work from home, either use vacation time or you won't be paid. The Municipal Employees Association, which represents white-collar city workers, filed an emergency grievance. General Manager Mike Zucchett said the city cannot take unilateral action to place employees in an unpaid status. The union looks forward to bargaining with the city regarding all of the options available to address the city's situation during this national crisis. That bargaining is set to begin Monday evening, and it's likely a prelude to even tougher labor disputes. The pandemic is wreaking havoc on city finances, meaning layoffs of city workers are all but certain to come. Andrew Bowen, KPBS News.
A hospital within a hospital is in the works at Palomar Medical Center in Escondido. A 250-bed federal field hospital will be set up on the 10th and 11th floors. Officials say the facility is needed in order to grow the region's bed capacity in the coming weeks. The decision about whether the federal medical station will serve COVID-19 patients or other patients will be made at a later time. A new coronavirus vaccine is now being tested on volunteers, and it was created here in San Diego. The Inovio Pharmaceuticals Lab began developing the vaccine in mid-January. It intended to begin human trials in the summer, but they moved testing up to this month. Up to 40 people will be injected with the experimental DNA-based vaccine. Testing will take place in Pennsylvania and Missouri. The first dose was planned to be administered today. San Diego County health officials directed hospitals to further restrict equipment used to protect healthcare workers from the coronavirus. KPBS health reporter Taryn Mento says a new alert directs facilities to follow crisis strategies to conserve gear during the national shortage.
Many facilities have already taken steps to preserve personal protective equipment, but the county's alert indicates that the shortage is affecting most, if not all, of the medical centers in the region.
It recommends facilities prioritize equipment such as gowns and masks for procedures that can make the virus airborne, like intubation, where a tube is put through the mouth and into an airway. That means healthcare workers may forego the medical gear in other situations that usually call for it. Philip Greiner is the director of the nursing school at San Diego State University. He says conservation strategies mean limiting access to the best defense healthcare workers have against the virus.
Personal protective equipment is the only thing we have. We don't have an immunization that we can give to providers. We don't have a cure.
The county says it has distributed more than 1 million individual items of protective equipment to facilities and is seeking more from the state and federal governments. The alert says future shipments will be distributed on a priority basis.
The county's alert also says to limit COVID-19 testing to avoid using more personal protective equipment. And it says facilities should remove face masks from public access, and a staff member can be the one who distributes them to symptomatic patients when they deem it necessary. Taryn Mento, KPBS News.
And this report was a joint collaboration of KPBS and iNewsSource. iNewsSource is an independently funded nonprofit partner of KPBS. You can now keep track of the number of COVID-19 cases in your neighborhood. The county is providing daily updates. As of Monday, zip codes in Hillcrest and El Cajon have the highest numbers, but health officials stress those are based on home addresses and not where the virus was transmitted. The highest number of cases involves people with no known address. You can take a closer look at COVID-19 cases by zip code at kpbs.org. The acting Navy Secretary had harsh words for the fired captain of the San Diego-based USS Roosevelt. Captain Brett Crozier was relieved of command after his letter pleading for help for his coronavirus-stricken crew made headlines.
That if he didn't think that information was going to get out into the public in this information age that we live in, then he was A, too naive or too stupid to be the commanding officer of a ship like this. The alternate is that he did it on purpose. It was a betrayal of trust with me, with his chain of command.
Acting Navy Secretary Thomas Modly made those comments to the crew yesterday in Guam. So far, 155 sailors on the Roosevelt have tested positive for the virus. Crozier himself has also tested positive. Nurses at the San Diego VA say they are getting mixed messages from supervisors on how to respond to the coronavirus. KPBS military reporter Steve Walsh says VA leaders admit there have been inconsistencies.
Around the country, nurses have been protesting the lack of staff and a shortage of supplies. This week, nurses who work for the Veterans Health Administration are protesting in Brooklyn. In San Diego, Brian Abert works as a primary care nurse for the VA's Oceanside Clinic. A representative of the California Nurses Association, National Nurses United, Abert says VA nurses in San Diego have some of the same concerns. Just prior to the governor asking everyone to cover their faces in public, a VA supervisor told two nurses to remove face masks they brought from home. I talked to Abert via Skype.
And they're specifically telling you that you can't wear a mask inside one of the clinics unless what? And you're in a certain situation?
Depending on where you're working, it's kind of a different message given by different managers. Our manager is lenient and says that you can wear it if you have access to it. However, it seems like some of the managers at the main hospital have been following a different protocol or different policy.
Abert says nurses are worried about the lack of consistency. He describes how the VA has set up stations outside most locations to check patients for the virus, following CDC guidelines. But that's not how it works at the clinic in Oceanside.
How well are they doing when it comes to keeping COVID-19 patients separate from the rest of the hospital?
They are doing checks on outside the building at most of the places. They have a station set up for checking and patients and isolating them at that point, but that's not being instituted at all the locations. Currently in the Oceanside Clinic, our people that are checking inside the building and not outside the building, where it'd be better for all included, the staff and the patients, because if someone through the questions is found positive, they move to a secondary place and they should already be outside, and they're not.
So they're not checking outside the building, they're checking inside the building?
That's correct.
A recent report from the VA Inspector General also criticized two other clinics at the San Diego VA for not properly screening patients before they actually entered the clinic. The director of the San Diego VA medical system, Dr. Robert Smith, acknowledges that there have been issues with screening.
We might screen right inside the door, and again, put people into secondary screening if they have any suggestion of symptoms or fever or anything else.
He says he has re-emphasized screening everyone before they can mix with the rest of the staff or patients. As far as whether nurses were told to take off their own personal protective masks, which they brought from home.
So I can't speak to what an individual supervisor might have said, but that was not policy. We do need to be clear, though, that personally owned gear, whether it's a mask or a bandana or whatever, is not a substitute for formal PPE.
On the question of hospital-grade personal protective equipment, or PPE, Smith says officials at the San Diego VA do not want staff to reuse hospital-grade masks, another concern raised by nurses on staff. Smith says staff has been told to keep the masks that have been fitted for them.
I think you hit the nail on the head when you said that the ball keeps moving. I think messaging and communication is probably the single hardest thing to get right for healthcare organizations right now. We have staff that are very concerned. The message that they get nationally is concerning, and trying to stay ahead of that has been challenging.
And is Smith able to get out a consistent message as this situation rapidly evolves?
Under those circumstances, that's not a reuse, for instance. That's simply a mask that's available to use. And I know some of our staff were confused that we were suggesting that they could reuse that mask when in fact all that we were doing was saying keep the mask and use it as PPE in the first appropriate setting when it's appropriate to use PPE, not reuse masks after that.
The San Diego VA has had 19 confirmed cases of COVID-19 among patients. Only one is hospitalized at the moment, though the system is still expecting a surge. Steve Walsh, KPBS News.
And it's a good time to stay indoors. That's because we're expecting rain and even some snow most of the week. Mark Mancuso has your forecast.
Slow-moving storm system bringing us rounds of rain, some thunderstorms, and some mountain snow. Some gusty winds into tonight with this slow-moving storm coming down from the Gulf of Alaska. We are looking at some below-average temperatures here, and snow levels, they will be dropping, and it does look like a couple of rounds of heavier precipitation. Round 1 with the front today, and round 2 with the upper low moving across Tuesday night and Wednesday. So looking at the storm system dropping down the coast slowly today, beneficial rain. Thunderstorms will be sprinkled about. There's potential for some flooding. And the storm max out of this would be around 5 inches in the mountains. Already north of LA, they've had 5 inches of rain. Looking at the temperatures tonight, we'll be dropping down to 50 in Oceanside. Over here in Ramona, down to 48, El Cajon 55, Borrego Springs 56, and Mount Laguna at 38. And it's going to be a wet night. Here's our futurecast showing you the significant rain with the front rolling through. And then once the front slips east, we'll see the precipitation becoming more showery in nature. And those showers and perhaps thunderstorms will be with us tomorrow and perhaps maybe even into Wednesday as well. So looking at that futurecast, we will be dealing with more showers through the day tomorrow. Now looking at our weather Tuesday, here the darker green, the thunderstorm zone. Otherwise, we'll see the showers up in the mountains above 6,000 feet, a significant snowfall, and then the snow levels will start to drop off as we take you into Tuesday night and Wednesday, perhaps down 4,000 feet or so. Looking at tomorrow's highs, well, it's going to be in the mid-60s in Oceanside, El Cajon, lower 60s, Mount Laguna in the 40s, and there we paint in the snow up in the high country. That storm moves slowly east, and still some showers lingering here, perhaps into Thursday. So looking at the coast, we could see 1 to 2 inches of rain. Better weather by the weekend. As we take you inland, could see up to 5 inches of rain as we take you up towards the mountains there. Better weather end of the week. In the mountains, could see several inches of snow. And as we take you out to the deserts here, we're wet, but the weekend looks mild and warmer. I'm meteorologist Mark Mancuso for KPBS News.
Not following distancing rules can have a financial impact on you. Local law enforcement agencies are now enforcing the state's stay-at-home order. San Diego County Sheriff's deputies handed out 25 tickets to people watching the sunset or having picnics near the beach this weekend. And the San Diego Police Department wrote a total of 16 citations to people out at Balboa Park and in Ocean Beach. The social distancing violations carry fines of up to $1,000, 6 months jail, or even both. This pandemic is causing big drops in ridership on buses and trolleys throughout San Diego County, and as a result, the Metropolitan Transit System is cutting back its routes by about 25%. About 3/4 of bus routes will see some cuts, leaving only 35 bus routes untouched. As for trolley routes, only the blue lines will be cut, so it runs less often during the daytime.
Relatively slight reduction in service. We have enough room for social distancing.
So far, one MTS bus driver has tested positive for COVID-19. The agency put up alerts on the routes that person drove to inform riders of the infection. Advocates for people living in nursing homes say the California Department of Public Health's decision to stop sending inspectors into those facilities during the coronavirus pandemic could have deadly consequences. KPBS reporter Amita Sharma explains.
California public health officials say all routine state and federal surveys of nursing homes have been temporarily halted in response to the pandemic. They say they're still investigating incidents at the state's 1,500 nursing homes through, quote, virtual, audio, or electronic methods. But advocates for residents at nursing homes say state surveyors need to be on site now more than ever. Nursing homes are under lockdown to stop the spread of COVID-19. Family and friends can no longer visit residents. Michael Connors of California Advocates for Nursing Home Reform says that means residents have no one to turn to if they're being neglected or worse, abused.
So it's incumbent at a time like this in the midst of a pandemic for our inspectors to be the public face in those facilities and to make sure that residents are safe.
A federal survey of nursing homes released last week found that 36% of the facilities inspected didn't follow proper hand washing rules. Amita Sharma, KPBS News.
San Diego County is now recommending residents wear face coverings in public. Government officials are buying 40,000 bandanas for the county's vulnerable populations. The CDC says bandanas can be used by healthcare workers during times of an extreme face mask or respirator shortage. But the county's Medical Operations Center Director, Rob Sills, says that's not the plan. Sills says in addition to the homeless shelter, the bandanas will go to high-risk or symptomatic people isolating in county-provided hotel rooms.
That may not be able to go and purchase these on their own or get them on their own so that we can give them to non-healthcare workers. We're saving our surgical mask and our supply of N95s for healthcare workers.
And he previously purchased 90,000 bandanas from the same local company, Planet Apparel. The county is also mandating certain essential employees, like grocery store workers, to wear a bandana or similar face covering. This report was a joint collaboration of KPBS and iNewsSource. iNewsSource is an independently funded nonprofit partner of KPBS. Now an update on our top story. Today, San Diego County officials reported an increase of 78 coronavirus cases. That brings the total to 1,404. The silver lining, no new deaths, and some good news from the governor's office. Also today, some San Diego Unified teachers started online instruction without grading assignments. Schools moved to formal grading 3 weeks from now. And you can find tonight's stories on our website, kpbs.org/evening edition. Thank you for joining us. Have a great evening.